Ron, thank you very much for inviting me to address this series of highly complicated questions. So I'll do my best to cover the landscape, and please feel free to interrupt and add in supplementary questions here. I think, you know, we're 1 year on now, around about 1 year on from the initial shutdown because of a pandemic and the COVID-19 pandemic. So where are we now? Well, we've learned a vast amount in a very short time about a new virus impacting human society. That's number one. We also know the breadth and depth of the impact that it has had on society, both socially, physically, economically, in every way, you know, known to mankind. What we have up against it, we have tremendous knowledge now that our original, you know, mask wearing and social isolation, social distancing worked extremely well to contain surges when we didn't have a vaccine. That there were ways to contain the virus, and this was sort of lessons that we had to relearn from 1918 when people debated whether masks worked or not. Well, masks and social distancing, travel restrictions, attesting to symptoms at work help enormously. But what we have now, in addition, I think it was something like 326 days after the beginning of the lockdown, is a vaccine. And actually, we have several vaccines out there circulating, being used, getting into arms. Some nations ahead of others. You've got Israel, you've got the US, you've got the UK, you've got Europe dragging along, and we have other models of countries that have actually persisted with their social isolation, travel limits, and mask wearing, that have also done a great job, even though their vaccination rollout has been slow. And that in particular is Australia, which is remarkable. It's completely flattened the curve, and vaccination has only been completed in emergency healthcare workers so far. Wow. So what we have now is knowledge and a constellation of activities, including public health measures, but now the vaccine, that are really helping to contain the pandemic. And that's a significant advance for 1 year.
Dr. Poznansky, over the past year, did a lot of the technology that facilitates communication, collaboration, was that helpful as you might have worked differently in 2020 with your colleagues, which all the communication platforms and be able to easily share genetic modeling? Is that another positive impact separate from creating vaccines, that technology has helped you work more closely and more effectively with your colleagues?
Yes, I think just by its very nature, the one world pandemic, you know, internet communicated planet basically did actually make a difference here. Doctors, healthcare workers could communicate in real time across time zones by Zoom and every other ways with regards to how to maximally manage this disease and manage patients. And I remember, you know, every week, every day, we were doing Zoom calls both nationally and internationally to make sure that our care for patients, where that was the frontier. The frontier was the disease was happening. We were going to have to wait for a vaccine, but how are we going to manage the patients? And the way we managed patients changed very dramatically because of the national and international communications. And it was really the era when I remember prior to the pandemic saying to colleagues, well, rather than traveling down to New York, let's do this by Zoom. You know, this was like 2 years ago. Let's do this by video conference. It will save all that travel, and the weather doesn't look very good. But suddenly, thrust into the pandemic, the video conferencing reached its need, and a staggeringly important aspect of our defense against the virus was the fact that we could communicate so freely across time zones and across the world to impact what we actually did. That's on the communication side. It's a no-brainer that made a massive, massive difference in terms of our combating the pandemic fast and in real time. And then secondly, were all of the approaches that involve bioinformatics and computational biology that suddenly met its sort of time in history to make impact, which is, okay, now we've got to make a vaccine, or we've got to come up with therapies in record time to combat a disease that is roiling through millions of people across the globe. And therefore, you know, things have to be done fast using computers, and the fastest computers known to mankind. And they met the, you know, these two, the need and the technology met up. What's really interesting, Ron, is what then became the limiting step. It's amazing. The limiting step became plasticware. You know, did we actually have enough test tubes to make viruses, to make vaccines in, or did we have enough test tubes or swabs to do COVID-19 testing in? That became the limiting thing. And if you can believe it, the next things were, do we have enough freezers scattered around the country that can store our vaccines that need to be frozen? I mean, no one had ever thought that that would be the limiting step. But, you know, how many -80 freezers do we have in Nebraska or in Tennessee or in New York? You know, that was never thought, but that became the limiting factor as opposed to the design and actual practical making of enough vaccines to actually test it to see if it was safe and efficacious. Okay. So that's a really big change in vaccine development and how we approach a pandemic that occurred.
And that's interesting because we see a lot within Angel Beat with initiatives like IoT and data tracking. It's different from using the cloud computing power to analyze human genome, but now it's so easy to track drug deliveries. It's easy to identify where items are. It's very, very powerful. So those are great insights. I know you're very busy, and we appreciate your insights in reinforcing or validating how technology has enabled the pandemic. I remember hearing stories where people are wondering when they want to model the human genome, they need a supercomputer. For instance, we're out here in Long Island where the Watson Cold Spring Harbor lab is based. Watson, the founder of the DNA double helix. Yeah. And I remember speaking to people who work there, and you know, they needed a supercomputer just maybe a decade ago to do their work. And now we're fortunate to have Amazon, Microsoft, and Google all speaking here. The real beauty is scientists, even a small biotech researcher in Germany is able to access the same computing power that was previously available only to the Pfizers and the Mercks of the world. I think it's very fascinating. And the final comment is, maybe you could also share how some of the technology is enabling you to work differently with patients going forward. And what do you see with regard to when you're dealing with initiatives like telehealth and whatnot? In your day-to-day practice, not saving the world, but saving one patient at a time, how do you see that's affecting you on a more granular basis in the future?
Yeah, well, to the changes in medicine that have been affected by the pandemic, it's obviously the rise of telehealth. So as hospitals couldn't bring patients in, then telehealth visits had to occur. And I think it's risen even now to about 50% of visits are done by telehealth. However, we have to recognize it's like the yin and yang of everything. So you've got all this information, and then there's all this disinformation. So and in the context of telehealth, there's all these telehealth visits, but there are also two enormous problems, which is that, okay, so you can have a telehealth visit, but you can't actually examine the patient physically. So we can't actually get to our patients, and the patients are lacking in human contact with regards to what they're actually suffering from. You can talk to them by the phone, over the Zoom or whatever, but you can't actually really find out what is going on. You're just connected in distance. Now that's okay potentially in follow-up appointments when people are getting better, but what if they're getting worse? You can't reach down the phone and find out what their pulse is or how their heart's beating or their chest sounds or stuff like that. And the second really important thing that I'd like to mention to get out there is that while you and I might readily get on a telehealth visit and we're computer able, an enormous number, and it's estimated around about 40 million people cannot get access to broadband and cannot get onto their telehealth visits. And the whole issue of the pandemic emphasizing the inequities in our society, whether it's vulnerability to the disease or access to healthcare or, access to telehealth, that is the thing that the pandemic has also laid bare. And from that point of view, Ron, I'm optimistic because when problems are laid bare, certainly in medicine, it gives you an opportunity to solve them. And I would say the people who are listening into your Angel Beat, these are the problems that are being laid bare by the pandemic, which we now have an opportunity across the board, business, medicine, technology, to actually go after and solve. The fact that 40 million people don't have access to broadband and don't have access, therefore, to the most kind of up-to-date aspects of dealing with this pandemic is actually a major threat to the people who do have access to broadband. Because a pandemic that's failed to be solved anywhere is a problem to everybody everywhere. And I think from that point of view, technology does have to get down into those weeds and address those problems for all of society, not just the proportion of society that have immediate access to those technologies.
Well, it's interesting you bring that up. We hear a lot about initiatives around the digital divide in education, another subject we're covering next month. So it'll be interesting to see what our government officials do, because the ability or the urgency for addressing the digital divide in education, providing everyone equal opportunity, affects everyone. And I think, as you correctly pointed out, the pandemic cuts across socioeconomic levels, race, gender. They may be predisposed based on your pre-existing conditions, but no one's safe from this. And so it's very interesting. It's also interesting, and I want to thank you for your time, because as I look at the future, many of the things we're going to be hearing about at our 2022 health program. What's going to be going on with your new clothing that's Bluetooth enabled, or your smartwatch that can give you more of those tactile sensations. You still may not be able to, you still may need to physically touch someone's abdomen if you're concerned about how it feels and you need that tactile sense. But it'll be interesting in 2022 when we can demonstrate a lot of the devices that can provide a more granular insights into what's going on beyond just a patient commenting, as I do in my televisits.
Yeah, Ron, I want to comment on that because, again, to your audience, I want to specifically say this because we work with a number of, we work with ADI and a couple of other digital-based companies, and the important point there to make is for those companies to work out what the actual unmet medical need is while they're developing their technologies. That is, so the interface between the medical unmet need and the device is critical. And I'm sure I'm sort of lecturing to the converted here, but the point is that there have been a lot of technologies in the healthcare area that actually don't juxtapose with what is needed. For example, the average person, let's say with congestive heart failure, doesn't necessarily have the manual dexterity to manipulate a special watch or a special whatever. But that's the majority of the patients with that condition. So there has to be device development based on who it is that needs that device. I mean, sure, if you want everyone to have their heart monitored 24/7, round the clock, all the time, which ultimately gets enormously boring and enormously unnecessary boatloads of information. But for the actual populations who need it, those devices have to look towards design in that population that fits.
Very good insights. We're excited to hear what you might have to say a year from now. I'm going to conclude our opening comments. So again, you could save patients one-on-one as well as trying to literally save the world. We appreciate all your efforts. I encourage everyone to follow Mark, get more information on Mass General, a world-renowned hospital, and specifically the Vaccine Center that Dr. Poznansky oversees. Thank you very much for your time. I'll let you return to your patients.
Thank you, Ron. Bye for now.